and she needs it, you know, you want to understand the reason why. So she needs it because she hasn't been able to avoid in like 10 hours or 12 hours. So we're going to go ahead and help her out with that. We've done a bladder scan and she has X amount of urine and things like that. Okay, so I washed my hands. I'm going to gather my equipment. So I'm going to need something. Typically, you might want to bring like a back blanket. This is just the disposable chucks, but you know, this probably would be something you would bring to cover them up with. I'm just doing that for now. So you bring a back blanket. You would bring stuff if you need to do care, like perineal care, but we'll say that that's been previously done. So that's already done. The CNA cleaned them up for me. So I don't need to worry about that. So I have my Foley kit, which has, we have a closed system here. It has a bag in it, so I don't need to grab a bag separately. Sometimes you have to grab all of your pieces separately, so you just have to kind of keep in mind what's in your kit. There's a syringe, there's you know, all of my cleaning solutions, my lubricant, my syringe to check balloon if I need to do that. And then I do need to bring tape separately, because most of the time the kits don't have tape in them. Okay, you might see that it does, but I don't think this kit does. So we're gonna go ahead and bring the tape. Okay, so what we're gonna do is we're gonna first come in. I'm gonna knock, knock, knock. Come on in. Hi Alice, my name is Jessica, I'm your nurse today. I'm gonna go ahead and provide for privacy. I'm gonna wash my hands. I'm gonna check her name band. Can you state your name and birth date? I'm comparing it with maybe the order or whatever I have. Okay, Alice, blah, 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 birth date. Are you allergic to anything, specifically iodine or any substance like that? Or latex? Most of these have gone latex free. You want to make sure, like this says latex free, but you know, just go ahead and check that because you never know. No, she's not allergic to anything, so we can go ahead and do that. I'm going to go ahead and get you set up. Now the CNA came in and cleaned you up, right? Yeah, she says okay. So I'm going to place her in what position? You guys remember?
Supine.
Supine, but it's actually a specific position.
Dorsal recumbent.
Good. The dorsal recumbent. So I'm going to put her in the dorsal recumbent. Now she doesn't have legs, but if she did, it would kind of be like, you know, like bent and then, you know, down. I'll show you in there if you really want to see it, but you can just review that. And I would have her, people tend to like scrunch their legs together, you know, because it's a private area, so you kind of have to open their legs up a little bit and tell her that you're just going to get your stuff set up over here, okay? So she's ready. I'm going to go ahead and start opening up stuff. Now, I asked her if she understood the procedure, and she said that she's had a Foley before. Maybe I reviewed what it was. You know, we're going to put like a durable tube, but kind of flimsy, so it's not stiff or anything. We're going to put that into your bladder to help you release the urine that you're retaining. So it's been 10 hours since you went to the bathroom. Maybe she's post-surgical, and we need to do that. So she understands that. And this is an indwelling, so this would stay in. What's the other kind called?
Straight cath.
A straight cath, and that's more of a stiffer tube. That's used for specimens. I'll see if we have any. Might be on the other cart, but that's kind of a stiffer tube. You go in, you get what you need, and you come out. So whatever it is, maybe you are draining the bladder. Some of you work with quadriplegics and whatnot. Aren't you straight cathing them, or are they straight cathing themselves? Okay, so some of them have catheters placed, but you would do that for someone like that who has difficulty with control. You would also do straight cath for specimens. So you do need to know the difference between both, okay? So this is an indwelling. I'm gonna go ahead and get set up over here. So I wash my hands, okay? I position my client properly. I'm gonna go ahead and prepare this. Now this needs to be, is that okay if I put it a little higher? Or is that too high for you guys?
Nope.
This table, okay. All right, so I'm gonna go ahead, my table's cleaned off. I'm gonna go ahead and open stuff so it says peel to open. So you're gonna, sometimes it's just a matter of getting these things open. Okay, I'm gonna go ahead and take this out. Now some of you like to use this bag as your trash. I don't, but if you want me to use it, I can show you how. I use the big trash can or something else, but we'll just pretend that, you know, that's the big trash can. It's just hard to get into this without contaminating. Let's see if we can stand it up there. There we go. Okay, so I see that I have a Foley kit. It is not expired. That's one thing you have to check. It looks closed. It doesn't look like it's been tampered with or anything. And I know what I have in it, so I don't really need that. I do need to know that it's a 16 French 5 milliliter catheter, so I can chart that. You're gonna see it's taped on the bottom here. So you always go away from you first, okay? One principle of sterile technique is you don't reach over an open field. So you have to do that one first to avoid that. The next is the side. Here's a side here. And I'm gonna grab my last one last and open this up like this, okay? The outer 1-inch border is considered contaminated. Now I don't wanna sit there and like touch it, but you can move this around by that outer 1-inch border, okay? But you wanna minimize how much you're touching the equipment, okay? And I wouldn't have my papers here, but we'll just do it so I don't forget. Okay, first what I'm gonna do, Alice, is, and actually this is a male, but whatever. It might be a male Alice, right?
Oh yeah.
I'm gonna go ahead and, this is gonna be hard without anything under him. Okay. Okay, Alice. We're gonna go ahead and we're gonna place this under you. And keep in mind, this is not an ideal situation, but I'm doing this on the table here, but lift your tush there. Okay, I think I got it under there. Okay, so we draped underneath, that's to protect the bed. That's considered somewhat of a semi-sterile drape, but I would not consider it sterile at all because I placed it under him and he might, you know, his legs might touch it or my hands might have touched it. So that is not considered sterile. I don't want you to consider that sterile. Then next is your gloves. So you take your gloves out. Now the outer packaging is, you know, sterile now, but it's gonna lay on the table, so you don't really have to worry about it too much. Now, I used to tell you to wait to put the gloves on and put that drape on first, but now I was told by another faculty that Banner is very specific that you go in the order in which it's in the box. Do any of you work at Banner?
I used to.
Are they?
They're really specific.
Yeah, like so.
Yeah.
So at first was that drape, and then you had the gloves. So they want you to put the gloves on next. We were trained. We put the gloves to the side, and we would always do that after we put this drape on. But I want to stay consistent with what the hospitals are doing now. So first the drape, now I gotta put my gloves on. So to put sterile gloves on, there's little folds right here. What I teach students to do, please don't open them over your kit like this. This is a no-no. You just contaminated everything in that box by putting your hand over it. I don't even wanna see it on the drape. I don't like this touching the drape, okay? I'm very particular about that. That's one of my pet peeves about this skill. What I tell students to do is put a little V in it like this. Because if your gloves flat back like that, which you're gonna see a lot of them do that, you just contaminated your gloves, okay? It's not okay. You see a lot of nurses continue, but really in reality, whatever was on their fingers is now in the gloves, okay? So I do tell you to put a little, kind of like a crease there. So your first glove, you're gonna take it here. You're gonna put it on like this. Okay, so you're touching, see how I'm touching what's gonna be inside? Okay, and I don't mess with this one too much yet. If the glove package is like going like this, I see you guys like it's all over the table, trying to get this second one on. Just stick your finger on the outer 1 inch, and you can grab this here. And sometimes, guys, the gloves are kind of stuck because wherever they store these, they melt. But we'll do our best. And you should take off all your rings. Okay, so I have both on now. I can fix this one if I choose to. Don't sit here and like perfect your gloves, you're gonna contaminate. Okay, as long as they're down, you're fine. Don't sit there and like try to touch everything. Now this, if it truly bothers you, throw it in the garbage. I'm just gonna leave it there, but not cover my cheat sheet for now. Okay, so next I'm gonna go ahead and put this drape on. Okay, so here's this drape, and now my hands are sterile. Oh, I forgot to tell you guys, on the drape that's under him, do you know what side goes down? Okay, good. Okay, this one, I'm gonna drape over him, but not touching. So if I touch this guy with my fingers, I just contaminate. So I gotta be very careful that I just kind of drop it on him and fix it after when I'm ready to start. I'll show you how to do that. Now what I'm gonna do is I'm gonna take my boxes, which are sterile. So sterile to sterile. I can only touch sterile items with sterile gloves on, okay? I'm gonna go ahead and prep. So my lubricant, I'm gonna open this up. I'm gonna take off the packaging off this. When you take off the packaging, guys, you're gonna rip down the middle like this. But if you wanna reuse your thing, you can just walk it down. But in real life, you're gonna rip down the middle. Okay, this would become trash, so pretend my trash can. Okay, then I'm gonna open this up and stick this inside the lubricant. Okay. okay? And I'm gonna set that back in my box. This, I'd say 90% of manufacturers, probably even higher now, don't require you to check the balloon. We used to test the balloon. If you did need to test the balloon, you have to do it before you put it in your lubricant. So just say I had to test the balloon, I would come here, I would take my syringe, I go into the balloon port, which is marked by a color, orange, and I would push the fluid in to make sure that it's not gonna rupture when the fluid goes in. They say now not to do that because the more you do that, the more likely it is to rupture the next time because you're using it, you know what I mean? And it's not meant to be used like multiple times. So now they're saying just go ahead and don't test your balloon, okay? And they like you to, just for time's sake, we'll just put that out. You wanna be careful pulling the fluid out because it can mess up the balloon also. We'll just, since we're in a time crunch. Okay, so just say we did that, okay? We'll put that in there. Next, I'm gonna take my, these have cotton balls, so you gotta fluff your cotton balls a little. You gotta open your iodine. Now, don't open any of this stuff in the lab either. This stuff stains, and if it gets on the mannequins or your clothes, you'll never get it out, okay? So this would go all over my cotton balls, okay? I'm not required to take a specimen, but if I needed one, I would remove the cap a little bit and leave that to the side. If you don't want to, you can just set that down. And I think I'm ready to go. Okay. This is gonna be a little difficult. I put my box between my patient's legs. Okay, so just pretend there's a bed there, and I put it right there. So we'll just say this is kind of between his legs. Do the best I can in this situation. Both of them nice and straight. If that's there, can you guys still see or no? Yeah? Okay. So this is between his legs. Okay. I'm going to go ahead and when you set stuff down, try really hard not to touch anything because it's, when you set stuff down, set it by the top and like this, or you'll contaminate your gloves. So what I'm going to do now, and we'll say just drape is still on here. I'm right-handed, so I would have to be on this side of my patient. If you're left-handed, do we have any lefties in here? One? Okay, he's going to be on this side. He's going to be on the other side of the patient, okay? So you're going to grab your patient. Now on a male, you got to have a nice firm hold, guys, okay? It's going to turn into one of those, those toys you used to play with? I bought my kids on this thing. No. I'm not kidding, that's exactly what it feels like, right? We had those as kids. The snake things, No? Oh, I bring my kids in, I just bought them one. They're hard to find.
Oh, like the wooden ones?
No,
like the little
it has
jelly
fluid inside and like you try to hold on to
fluid
it.
and try to hold on.
They had them at the Rainforest.
Oh, yeah.
Oh,
Those were
what
cool.
are they called? Snake? I don't know. Okay.
Yeah, they got like little animals.
Okay, so you're gonna take a firm grip, and this hand is now considered contaminated.
Yeah.
Okay, so you're gonna take your cotton ball, and this, you're gonna clean on the male in a circle, going back. Trash. Next one, same thing. Okay, trash. They give you 5, you probably only need 3, but, because in the swab sticks, which I don't know if we have any to show you, but we'll give you some, you only get 3 swab sticks. So just pretend we're going around. Okay, this is now trash. Okay, I'm gonna take this tray, if it's in my way, and just kind of get rid of it. I gotta move this up a little bit. Okay, and then the lubricant I take off. Just gonna move this a little closer. In the bed, I would be closer to the guy, but because I'm so far away. So what I'm gonna do is I'm gonna start inserting. Hey, are you okay? I never even talked to the guy, sorry. But take a deep breath. I told him I was cleaning him and I feel cold. Okay, I said all of that. I'm gonna go ahead and start. Okay, take a deep breath. Okay.
Ouch.
Sweet spot in there. Well, these are hard to do. Hit something in there. Well,
Is a real human being easier than?
usually, I mean, males though are kind of. I have a lot more trouble with males. than I do with females, because males,
You can't see what you're doing on a female most of the time.
well, you
At least you know the hole in the man.
Very
I'm
serious.
dead serious. I do these all
No,
the
there's a
time.
sphincter, oh, I got it, see, there's a sphincter that,
I
is
know.
closed, so you have to kind of like get that to open up a little. But, and I was doing them on kids that were 2 years old. I can't, I mean, you know, there's nothing there to hold, so that was why my difficulty was with males. But, okay, so just pretend it went in
Okay, can I
really
ask
nicely.
about the elephant that's in the room right now? What if your male patient starts to get erect?
They probably will, that's fine.
Isn't it harder
It will
to
go
get
down
there?
real quick once you put that tube in.
Well,
Yeah.
I'm just assuming it would be harder to insert the catheter.
It will go down real
Despite
quick.
the force.
Yeah,
Put that tube in.
I can't get it in my sword, but anyway, you're gonna go, don't let go of it, but you're gonna get it, you're gonna go pretty far, like sometimes there's a bifurcation depending on the male. So just pretend we're all the way there, okay, everything's good, I'm gonna then take my fingers and secure it, because if I let go of it, guys, guess what, it's gonna be sitting in the bed. And I just did all that to that male, he's gonna get really mad at you, okay, anybody's gonna get mad at you if you have to do it again. So hold it there, I'm gonna go ahead and try to blow this up without, you're gonna splash sometimes, it's, you know, little syringe blows off. Okay, now I'm in somewhere, so I'm good, okay? So I'm gonna go ahead and then don't let your finger off the plunger, because if you do, look what's gonna happen, the water's gonna come back out. So you're gonna take your hand now and twist it off.
Did you kind of test, like, before you let go of it, you kind of felt that it was in there, like that the balloon is?
Well, what I tell my patients also is if you feel any type of pain or any problems, let me know, because if I'm not far enough in, that's gonna hurt a lot. So I just, with the males, you're going all the way, typically. With the females, you're gonna go until you see urine and then go another, like, 1 to 2 inches. Okay, so then you know you're in for far enough. Then I'm gonna go ahead and give it a tug. I'm good, don't give it too hard.
Okay.
Okay, then I'm gonna take this, now my gloves might have iodine or whatever, so I would remove these and put new ones on. To remove gloves, guys, remember to do it properly, so you don't contaminate anything. So I'd get some, clean gloves on. Now, at this point, I just need to hang the bag, clean him up, and, sorry, my hands are sweaty from those gloves. Don't use these gloves, if your gloves rip, don't use them, you know that way.
And in the hospital kits, a lot of them have a leg sticker.
Yeah.
And these
Stat
things will.
Stat locks, yeah.
Stat lock, yeah. And so the tube will hook inside these clamp on my leg, so you would do that.
Yeah, so if we had our stat lock, we could, secure that. The stat locks typically go a lot higher, they would go around in this area versus when you do tape, you always want to tape on the clear. Okay, so depending on what device you're using, they all kind of do different, how they lock and things like that. But just pretend his leg was here, you would go ahead, and I only have tape. So I would hang this on the bed. Where would I hang the bag? Like the frame, not the side rails, because those are movable parts. So we'll just pretend that's hanging, not pulling on them like that. I would take a piece of tape.
Sorry, Mr. Jones.
And tape, guys, you can't use paper tape. Well, I've never had luck using paper tape. I don't know about you guys. Once that doesn't stick very well to skin, unless they have an allergy or something, you gotta figure something else out. But if they can handle something like either a plastic or if you have the stat locks, obviously you would use that. But you're gonna go ahead and tape this as best as you can. Sometimes people go around the tube. I'm not like the Foley queen because we tried really hard not to do these. But if you guys have any taping techniques, some people would, I remember some nurses that I saw would do a chevron, like they would go around the tube. Some people would just do this and then put another piece to secure it. We got the stat lock, so I don't know if there's any ways, you'll learn new methods, but just so if they pull accidentally, it's not gonna come off. So that's why I kind of put it around the tube and then tape it to the leg. You might even secure it again if you need to, okay? These can be pulled out, and that's it's bloody and not pleasant. Either they're not with it, so they're pulling at tubes, or they accidentally get stuck on something. So you don't want to leave like huge amounts of loops or space. You also never want to have a loop in your catheter. You really want to try to avoid those because the urine gets stuck, and then it just either sits there or it runs back the other way. Okay? So So then what I would do is I would go ahead and clean them up.
Bless you.
So I took
Thank you.
my, just pretend I had a washcloth. I'm gonna clean around, don't leave any moisture anywhere. I'm gonna take all of my drapes, throw everything away, cover him back up, record the urine. So there's, this is hanging on the bed, there's, I don't know, maybe he had a lot. So there's 1,500 milliliters. We really let it go far. Just say amber, colored urine. It's clear though, the clarity, I mean, it looks clear. If there's anything like floating around or anything, you wanna note that, any like sediment or anything like that, you wanna note. How the patient tolerated it, so patient tolerated procedure without complaints. You don't just wanna say well, because well is very subjective. So maybe, what is that? What is the scale for well? So you just wanna say if anything happened. So patient tolerated without complaint, patient, educated on procedure or whatever else after if they need to do anything with it. You also wanna say what you put in. So how I would start my charting is I would say 16 French, Foley catheter inserted, via, or using hospital policy or using sterile technique or however you wanna say that you followed the policy of that procedure, if you did. You'd wanna say the patient tolerated without incident or complaint. The urine was 1,500 milliliters of amber, colored urine, clear, no odor noted. What else would you put? Trying to think. That's it for documentation. Am I missing anything? It's hard to visualize it when you're not doing it. Okay, I think that's it. So then I would tell him I'd be back to check him. This bag needs to be emptied. I mean, obviously I wouldn't leave 1,500 and leave. I would empty it in a graduated cylinder and then it would be ready to go. Then you want to have your CNA, or if you're available to empty that, or whoever does it on your unit, what your policy is, you would want to have that emptied periodically.
The other things that are included in documentation usually is like how much fluid you put in the balloon.
Oh, yes, so
Yeah.
now it says 5 milliliter balloon, but if you read the instructions, it says to actually use all of the whole 10. So even if it's a 5 milliliter balloon, you're putting in 10 in there. That's just how it works. So if you need to look at that, say 10 milliliters of, sterile water or whatever, injected into the balloon, replacement or whatever, okay? And then I would clean up, I'd tell them I'd be back, I would wash my hands, and then I'd be done. Good?
Great.
Did I do a good job? It's hard to break down a skill that, you go. And then on the female, I just wanted to show you, just wanted to show you really quick. On the female, the only thing that differs, when you're taking it out, guys, you just want to put a syringe on, okay, a 10 ml syringe, and then let the fluid come back. It'll come back by gravity, and then you want to just obviously have gloves on, and you would just take this out and kind of do that in your hand, put your glove around it. One other thing I forgot to mention is the first sample that goes into this bag is considered sterile. So if you wanted to use the sample, you could use it from the bag in here. Okay, if not, you'd want to come to this port, and actually you can talk about how to get a sample out of it, is that okay? But you would come to this port here, and this port is used to obtain a sample. And Carrie is doing specimens today, so she can remind you of how to do that. So let's talk about the difference on a female. So you have a female here. The only difference, and I'm not gonna go through the whole thing or put gloves on or anything, so remember to do all that, but so on her, you would go ahead and you have to open the labia so that you're cleaning properly, and you're gonna go side, trash, middle, okay? That's the only difference. And if you look, when you're doing the middle one, sometimes the meatus will spasm a little bit. They say, I don't know if you guys ever heard this,
Winks
they
at you.
winks at you. Did you ever hear that? Okay, please tell us that. So if it winks at you, look for it. You know where it is. Now what if I go into the vagina first? What do I want to do? You know,
Get a new catheter.
Yeah.
get a new catheter,
sure.
leave it. They say leave it. Okay, so leave it, because, so you don't go there again. Leave it there, and
You never know where you're going.
you never know, it's, well, on some people, some it's easy, but I've had some, like I did one with a clinical where she was so, it wasn't in the middle. Like Anna talked, it was so far to the left. I've never ever seen that before. I was like, where is it? It was like, it was not right. Like, I was like, how does she go to the bathroom out of that? I don't know, it was weird, but like, it was so far. I was like, and so the students couldn't do it. I had to do it eventually. They tried like 4 times.
That's why they make
And they kept going into
oval
the
toilet bowl.
So she was like,
You shoot
oh,
both sides.
fine. Like, she's not saying anything. And that's how you know you're kind of in the wrong spot. Usually is they don't really move. They don't really say a peep. Then when you go into the meeting, they kind of, you can tell that it hurts more. I mean, it hurts. Where the vagina won't hurt them. They'll just kind of sit there. So leave it in, you know. So you would leave this in, just say you went to the wrong spot, and then get another one. You can't use the same one, so don't pull it out and then go into the, right? That would be terrible. I hope nobody's doing that. And then just grab another one, and you would go into the proper area. Okay? Okay, so any other little tips or tricks?
You just have to really make sure you spread the labia open.
Going the wrong hole.
Sometimes you can take a flashlight and look up in there.
Okay, your pen light.
Like,
Yeah, I'd have the students hold it for me, the pen light. Like, hold the pen light there. You might have to have help too, especially if you have somebody who's, you know, has a lot of weight or anything. You really have to almost have 2 nurses
3 nurses.
to hold them.
Take it
Yeah,
full though.
and I also had a nurse, I was trying to do it on like a 2-day-old, and so small down there, so, and it was too slippery. Things get slippery, you know, my hand I couldn't hold anything open. So another nurse took 2 sterile gauze, because they were dry, and just held open. So you guys kind of have to troubleshoot. So they held with 2 sterile gauze, so I could actually see like where I was going. So you gotta just be creative. I mean, it had to be sterile, obviously, but 2 sterile gauze, and they just held open. So we've all probably done different things. I mean, holding legs, things like that, holding folds up. You know, there's lots of things that you guys practice on these mannequins that are perfect and have nothing on them. But then you get to clinical and you go, wait a second. They never told me how to do this, you know? And I had a student that froze because they weren't circumcised. They literally could not proceed with the skill. So I said, let's step out of the room, let's talk about how you do this. So we just said, you know, pull the foreskin back. Like they didn't know, they'd never seen something like that. So you guys need to think, you know, outside of the perfect, you know, lab that we have here. Oh, what if they aren't circumcised? What if they are, you know, 300 pounds and what's that?
You pull the, because depending on the restriction,
The street.
when you pull it down, it will go tighter on the shaft of the penis. And so
Right.
you want to do that just enough to put the tube down, and then we'll
But
push
not,
the circle.
yeah, you always put it back over.
Clean,
Yeah,
pull the skin back up.
yeah, because if you leave it down, it can become a medical emergency if they become erect and it cuts off the blood flow.
Okay. I had a patient like that, but that happens here. It really swells. Oh my God. They cost him another night in the hospital. We were trying to transfer him to skilled nursing, so yeah, I just have to be, I think a surgeon can do this often.
Okay.
Sometimes the foreskin will pull down because they don't do pericare on themselves. And so the foreskin gets tighter.
Kind of grown,
So
yeah.
you just have to pull it down just enough.
Just enough, so be careful guys, and you have to know all this stuff, because when you get into clinical and you run into these situations where you're like, wait a second, that doesn't look like this. Right there, a big hole, it doesn't look like that, okay? And it doesn't look like, you know, necessarily like that.
Now that's
Yeah.
Yeah, that's perfect, and it's right there, and it went in kind of nicely. Now, we do have, don't use this lubricant on our mannequins. It doesn't go away, ever. We have a special spray in the lab that you can't spray on these to get it to glide in a little bit better. Probably should have done that with him.
And it is a little bit more difficult. You may think males it's a little easier to put the catheter in, but if they have prostate enlargement, that's very hard to pass. Sometimes you have to use a special catheter called a Coudier catheter, which has a special, it's a special tip to it that's kind of curved. So sometimes urologists, we have to call them to put them in because it's so hard.